General head, ears, eyes, nose, and throat exam. Begin the exam with inspection of the head and neck for asymmetry, deformity, scars, lumps, involuntary movements, hair loss, and edema. Next, palpate the head and neck with the pads of your fingers and identify any tenderness, deformity, or masses. Assess the integrity of the temporomandibular joint by placing your fingers in front of the tragus of both ears. Ask the patient to open and close their mouth while you palpate the joint. Note any tenderness, crepitus, or limited range of motion. Next, palpate the superficial lymph nodes in the locations shown: occipital, postauricular, preauricular, tonsillar, submandibular, submental, anterior cervical, and supraclavicular. Inspect the thyroid gland for any visible enlargement. Position yourself behind the patient and palpate the cricoid cartilage. Move downward 2 or 3 rings to palpate the thyroid isthmus. Move laterally to palpate the lobes of the thyroid. Continue to palpate while the patient swallows and feel for movement of the thyroid gland. Wash your hands before inspecting the external eye. Inspect the eyes for ptosis, exophthalmos, lesions, deformity, or asymmetry. Pull down the lower lid while the patient looks up to inspect the conjunctiva and sclera. With both eyelids spread, ask the patient to look in all 4 directions while you inspect the bulbar surface. Wash your hands before proceeding with the exam. Position yourself approximately 2 to 3 feet in front of the patient. With the pin light positioned in between your eyes, look to see that the light reflects symmetrically off the patient's pupils. Now, 3 to 6 feet in front of the patient, instruct the patient to hold their head perfectly still and follow your fingers with their eyes. Move your fingers in a large H configuration. Remember to test convergence. Now inspect the external ear. Palpate the mastoid process and then gently move each ear, asking the patient to identify any pain or discomfort. Use the otoscope to inspect the internal ear. Change specula before each use. Grip the otoscope with one hand, bracing your pinky against the patient's temple. Pull the ear up and back with your other hand. Insert the otoscope to the end of visible hairs, but not too far to cause pain. Examine the ear canal, eardrum, and ossicles. Change the speculum on the otoscope before examining the nose. Insert the otoscope into the nostril from a lateral angle. Be careful to avoid the septum. Begin the inspection at the floor and move upward. To examine the mouth and throat, shine the light from the otoscope into the mouth and inspect the anterior structures. Inspect around and under the tongue as well. Use the tongue depressor to inspect the posterior oropharynx and ask the patient to say "ah." Inspect the tonsils if present. Use a gloved hand to palpate the inside of the mouth. Use the other hand for counterpressure on the outside to examine the lips and cheeks. Palpate anterior structures and the floor of the mouth. Pull out the patient's tongue using gauze and palpate the top and bottom of the tongue. To palpate the deep cervical lymph nodes, hook your fingers around the anterior edge of the sternocleidomastoid muscle. Ask the patient to tilt their head forward and toward the side you are examining. Move the SCM backwards while you palpate for the lymph nodes. This may be uncomfortable for the patient. If you suspect sinusitis, test for facial tenderness over the sinuses. Press firmly under both eyebrows for the frontal sinus and over both maxillary sinuses. Note any pain or tenderness. You may need to inspect the inside of the eyelid if you suspect a foreign object, infection, or inflammation. Ask the patient to look down. Gently grasp the upper eyelashes and pull the eyelid out and down. Place a cotton applicator above the eyelid and use it to gently turn the eyelid over. Inspect the conjunctiva. Ask the patient to blink to flip the eyelid back. Pneumatic otoscopy is a technique primarily used on pediatric patients. Hold the otoscope angled as shown with your pinky bracing against the cheek. Grip the bulb in the other hand. Pull the ear down and back and insert the otoscope into the ear canal, obtaining a proper seal. Gently press the bulb and observe the movement of the tympanic membrane. Lack of movement is suggestive of otitis media. To confirm sinus infection, inspect for sinus transillumination. Place the otoscope light over the maxillary sinus. Darken the room and ask the patient to open their mouth. Observe for a subtle glow inside the mouth. Compare on both sides. Failure to transilluminate suggests a sinus infection.